How do you solve impacted lower 7 with ramus screw? The patient comes with chef complaint of crowding, and SAFE revealed dental and skeletal class 1 with flare incisors. So we decided to perform 4 bite extraction to relieve crowding and correct the anterior inclination. Note the teeth number 47. It has already erupted, but on the other hand, the 37 hasn't. So should we suppose ankylosis on this teeth? Let's wait. Look at the age of the patient. He's only 12 years old. And the eruption time for this teeth is between 11 and 14. So we decide to wait until patient reach 14 and correct the crowding first with clear aligners. 1.5 years later, after the first set of aligner has come to an end, and now patient has reached almost 14 years old, let's look at the panel. Did the teeth erupt? Nah, it did upright a bit, but still under the bone. So what's your treatment plan? We decided treatment plan A, since the teeth has upright a bit, it might just need a little help to erupt. So let's look at the anatomy first. In this region, there's thick muscle and highly movable mucosa, so we need longer screw, which is 2 by 14 ramus screw, in order to engage into the bone 3 millimeters. And there's an often asked question, is it going to poke the inferior alveolar nerve? According to papers, there's still 5 to 8 millimeter distance between the screw tip and the mandibular canal, so it's not likely to poke the bone. And this is how Dr. Chris inserts the ramus screw. If you're interested, you can find on this YouTube channel. And let's dive into the surgery phase. First, our incision did not extend to the papilla between 35 and 36. Since our teeth target number 37 is not really deep, we can still have clear vision under this design. First, we'll use carbide burr to remove the covering bone, and then we use elevator to luxate the bone from ankylosis. Then we bound the button with flowable racing to secure it. And normally, the force scale for this power chain is 4 ounces. Then we'll bond 2 power chain on it to prevent if one fatigue or fall off. And this is the afterward picture. So 1 month later, the teeth did upright, but there's still a thick soft tissue upon this teeth. So we use electrocautery to remove the extra soft tissue and wait for 1 month for the tissue to heal, and we're ready for scan another time. So what's the most important thing in this surgery is that how to prevent ramus screw head from occlusion. And this is how we do. We ask patient to bite down, and then we know where the occlusion is. Then we use this probe to make a physical rehearsal. And this is the place where we place our ramus screw. So that's it for today's video. Thank you for watching. See you next time.